Hello, good morning, good afternoon, good evening, depending on where you are in the world. Thank you very much for joining us. My name's Alastair Brown. I'm the Editor-in-Chief of the Lancet Planetary Health. Thank you for joining us for this webinar. We're going to talk about publishing with the Lancet Planetary Health. Without further ado, I'll jump straight into the agenda. We're going to start with a little bit of housekeeping, mainly just introducing the software that we're using. Then I'm going to talk about the journal and about our scope and mission. Then we're going to jump into a pre-recorded section, which is going to talk about the points on preparing a manuscript for selected journals. And then we're going to talk specifically about our editorial processes, so the things that we go through as editors and the way that we deal with your manuscripts. And then we're going to finish with a Q&A section at the end. So housekeeping. The main thing is just to emphasize that we really encourage you to submit questions throughout the webinar. You can do that at any time, but we probably won't answer them until the Q&A session at the end. And to do that, you can just find the box on the dashboard, ask a question, you can submit the questions and they'll be listed for us to try and get back to you on at the end. You'll also see on the dashboard that there's a box called Related Resources, and it contains links to related content which are featured on thelancet.com. So if you're interested in related content, you can go and explore that there. You can also adjust or minimize any of the boxes that appear on the webinar dashboard to suit your preferences. And there will also be a link to an on-demand version of the webinar, which will be emailed out to you once the event is concluded. So a recording of the webinar, essentially. And then finally, once it's finished, we'd really appreciate it if you could give 30-second feedback in the survey, just to make sure that we can continue to improve our webinar offerings. Okay, first, I'd just like to introduce you to the editorial team. So I'll start with myself. My name's Alastair Brown. My background's in, my first degree is in environmental science. My PhD's in paleo and climate, so long-term natural climate variability. And then after that, a little bit of postdoc work, I started working in climate adaptation before moving into journal editing. So I started my editing career at Nature Climate Change. I was there for about 8 years. And then in 2019, I came over to run the Lancet Planetary Health. So I've been here about 5 years. And then joining us today is John Carson. He's also got a background in kind of paleo environment and ecology. He also has a PhD in that area. He's also worked at numerous journals in editorial, Nature Human Behavior, Lancet Public Health, and then in the last couple of years, he's been working with us at Planet. And then last but not least, Haoyu Wang. She's based in the Shenzhen office. And because it's very late there, she's going to be joining us with a pre-recorded section of the meeting. But her background's in environmental science and microbiology. And before joining the Lancet Planetary Health about 2 years ago, she was doing a postdoc at the Southern University of Science and Technology in China. So I'm going to present the first section, then I'm going to hand over to a pre-recording of Haoyu, talking through the second section, and then John's going to finish up. Okay, so Lancet Planetary Health journal was launched in 2017, and we publish content throughout the year, but primarily in editorial issues, online only issues. We publish research articles, obviously, which is what we're going to be focusing on mostly today, but we also have a review section where we publish the conventional reviews, also systematic reviews and personal views, which are a bit more, have a bit more license to be forward-looking than conventional reviews. We also have a comments section, correspondence, so letters to the editors, and a news feature section, which is commissioned, where freelancers write some news pieces for us. It's a gold open access journal, so there is a article processing charge for publishing with us, at least for research and review content, not for comment, correspondences, etc. But we're free to access for everyone. If you've got any questions about that aspect, then just pop it in the Q&A box and we'll get to it at the end. Okay, so what is planetary health? It sounds nice, but what does it mean? The definition that's probably most widely used and understood is derived from the 2015 Planetary Health Commission published in the Lancet. And that definition is up on the screen: the health of human civilization and the state of the natural systems on which it depends. And I think it's probably fair to say that was a deliberately expansive definition, so inclusive, but it can be quite hard to know exactly what that means in practice. But over the years of running the journal, what we found is that planetary health is used in multiple ways. It can mean multiple things. There are some advantages to this, but in practice, there is not only one correct way, or at least in practice, there are many different ways in which it's used, and it's not our role to try and police what is the correct definition of planetary health. And indeed, authors don't necessarily even need to self-identify as being primarily planetary health researchers in order to submit to us. I would say in general, our approach is that we're open-minded and we'll consider any research that contributes substantially to our understanding of societal development and its interactions with the environment. Obviously, one of our particular foci is human health, but we don't necessarily require direct health outcomes. And what I'd say is, if you're in doubt, if you think that we might be a good avenue for your research and you're in any doubt, then send it to us and we'll get back to you quickly with a decision. Or if you're not sure about that, then you can send a pre-submission inquiry and we'll do our best to get back to you with a kind of a indication of whether it's likely to be in our scope or not. Okay, so for me, I think maybe just because I'm a kind of a visual thinker, it helps me to have a kind of a visual representation of what planetary health might mean. And the one that I find the kind of simplest and most effective is this donut diagram from Kate Rayworth. It's called the donut because it's got a big green ring or donut in the center. And that depicts this idea of a safe and just space for humanity, the green donut. And this notional space exists within ecological ceilings, which are defined by the planetary boundaries framework. And the base of the donut, if you like, the inner ring, is defined by the social foundations required for a dignified life. So they're defined by the kind of minimum resource requirements to meet fundamental human needs. And so the aim is for us to, and I think a healthy planetary future would require us to be operating within this safe and just space. Some of these, quantifying some of these things can be challenging, but I think it's a useful kind of framework for thinking about what planetary health would look like. Of course, the question is, how are we doing? Are we in the donut? I'm sure anyone on the call probably knows we're not. And so this diagram's a little bit old now, and actually we're crossing a few more planetary boundaries than are indicated here. But you can basically see when you look at how we're doing that we're exceeding planetary boundaries, so we're using too many resources at an unsustainable level, which threatens the stability of the planet on which we depend. But we're also failing in terms of people's requirements. So many people around the world are not getting all the things they need. So in short, we're using too much resource to too little benefit for humanity. So what does that mean in terms of how does that affect our kind of scope and aims? So we're really wanting to encourage research that tries to help us understand how to transition into this kind of idea of a safe and just space. So one that respects planetary boundaries and maintains the basic social foundations of healthy life for people. And in practice, that means we're interested in all important aspects of societal development and its interaction with the environment. So that can include drivers of change, the implications of those changes for people and society, and also the kind of practical policy interventions that might move us towards a healthier place. And so now I'll just go into the kind of really practical stuff. So what does that mean? So far I've just really talked about quite high level kind of conceptual ideas. And this slide's just to give you an idea of some of the kind of common topics and themes that we publish or seek to publish. So, for example, health and climate change. So, quantifying, for example, the effects of climate change on health, maybe maybe heat on excess deaths or hospital admissions. Health co-benefits of climate mitigation policy. So, what might be the health benefits of policies that seeking to reduce emissions, for example, through improving air pollution. Carbon intensive healthcare provision itself. So healthcare is quite energy intensive. So are there ways that we can do that, maintain care standards, but with lower environmental footprints and things like climate adaptation? So how can we adapt to those changes that are already baked into the system? Another really important area is food systems. We know that the food we eat has a huge impact on our health, but it also has a huge impact, or the food that we choose to eat can have a huge impact on the environment. So there's sustainable healthy diets is a really key area within planetary health. Also things like food environments, which ties into the commercial determinants of health. So how does marketing or the product selection and choice, how does that affect our diets? How does that affect our health? And how does that affect the environment? Water resources is another really important area. Obviously, wash interventions, but also there's links to food security. An awful lot of agriculture is irrigated and is a huge use of water. It affects freshwater biodiversity. So if we draw too much water out of the environment, it changes the flows and water levels in natural systems, affecting biodiversity. And obviously climate change is affecting patterns of rainfall and frequency, etc., which has impacts for water resources and things like flooding. Biodiversity and health is another really key area. So what are the kind of benefits or costs and benefits of green space and exposure to nature? Initiatives like social prescribing. Not everything's positive, so it's things like allergies, hay fever and such like, but also ecosystem services. How do we benefit from the services that ecosystems provide? And obviously, since COVID, zoonosis has been a really key theme that people are interested in. Environmental pollution, things like the health effects of, e.g., pesticides, industrial chemicals, mining waste. Air pollution is a very big area, and microplastics seems to be something that's increasingly a concern. Certainly they're ubiquitous. How big an impact they're having on the health, people's health, is still something that is very much under investigation. Transport and urban planning. So urbanization is one of the kind of major trends that increasingly people are living in urban environments, and those are planned environments. So what does that mean for example, urban heat? Urban heat island effect can affect can increase local temperatures, so make heat waves more extreme. Things like active transport and also inclusive transport, transport access, and what policies work. So what policies have been implemented and how effective are they in changing urban transport systems, for example, and changing the way that people move. And that leads into a kind of last point here about campaigning, governance and policy. I just kind of re-emphasize, I think, this point that lots of research is problem describing, essentially. So it's trying to describe the relationship between a problem and, say, a health outcome. But it's not necessarily, apart from providing information that should compel change, it doesn't actually help us to bring about change. And I think that increasingly it's clear that this kind of information deficit model is not working. So information is definitely necessary, but it's not sufficient. So we need to think about what might be the structural barriers to change, incentive structures, economic imperatives, what kind of communication works, how do we provide the right kind of information, how do we combat misinformation, how do we generate science-based targets which might inform policy, and just general questions about wider questions about science policy interface and how that works. And that leads into the big questions like geopolitics and political science and economics and international relations, these kind of things. Okay, so that's a kind of whistle-stop tour of Lancet Planetary Health, like our scope and mission, the things that we think are important, and some of our emphasis. We're going to move next into a pre-recorded section by our Chinese colleague Haoyu, and where she's going to talk about some of... No.
Hi everyone, it's a pleasure to be here. I'm Haoyu Wang, the editor of Lancet Planetary Health. I'm going to be talking to you today about some points on preparing your manuscript that hopefully will be helpful when you are thinking about not only writing a research paper, but also coming up with a research idea in the first place. There are some practical points, the general points about writing the paper. The title and the abstract are absolutely vital. When you submit the paper, the first thing we actually look at, obviously, is the title and the abstract. And so you need to make a good first impression with those. You are telling a story, you need to tell it as simply and concisely as possible. You need to ensure that you have a logical layout of arguments, or your data collection is given in a logical sense, which will make sense to the reader. And I think absolutely essential thing is when you got the first draft to show it to a colleague And I think it isn't working immediately if the colleague is in your field. Get somebody outside your field and let them read your paper. Because if they don't understand it, then there's a very good chance that the majority of your readership and also the editor don't understand it either. Cover letter is a good opportunity to convince the audience about how exciting and important your work is. So in your cover letter, you can summarize why did you do this study, what question does it help to answer, what does it add to existing knowledge, and highlight the unique aspects of paper versus current practice and existing literatures. You really do have to make sure this is very clear in your writing, but not just in cover letter. I think this should be something that's very clear from the manuscript, from the abstract, from the rest of paper. You need to know that. Please don't repeat the abstract, since it cannot provide any additional valuable information. You can also suggest some peer reviewers if you wish. We will check for conflicts, and we won't invite only from your pool of suggestions, but a few suggestions can be helpful to the editors. We will also respect reasonable requests for exclusions of competing researchers in the cover letter. First thing readers is the title. The title needs to be succinct. It needs to attract the reader's attention, and the title should directly reflect the content of your manuscript. Of course, you want the appropriate audience to read your paper, so if your title is inaccurate, the right people may not read it, and the community may not be aware of your work. A good idea is to check whether your co-authors are happy with the title that you give in your paper. According to the Lancet policy, you should use a non-declamatory phrase. If the title catches a reader's attention, the next thing they check is the abstract. Absolutely, this is the core part of your paper. This should summarize the problem, the method, the results, and the interpretations. The abstract as an advertisement for your article, since it is freely available via online searching and indexing. You want to make it as catchy and accurate as possible to have the greatest impact. A clearly written abstract will strongly encourage the reader to read the rest of your paper. It's also very important to put sources together in the research in context panel to tell us what evidence was available before the study, and how about the quality of that evidence, and how your finding add value to the existing evidence, and what the implications of that of a policy, practice, and future research. This panel is what we are trying to sort of help you to make that case to editors, but also to readers and peer reviewers. Next is the introduction. The introduction is used to provide context for your manuscript and convince readers why you work advanced in the field of study. It should be concise to give the readers enough information to understand why the work is important. You can ask questions. Are there an existing solution? If so, what are they about? What are their limitations? What is your work trying to achieve? The introduction does not need to be a history lesson. You do need to introduce the main scientific publications on which your work is based. Ideally, quite a couple of original important works to give the reader a sense of how your work fits into the existing literatures. But be careful not to make citation to irrelevant references, and make sure you clearly address what problem that you are ultimately trying to solve. Let's move on to the methods. The method section should be clear on what you did. What type of study is it? There are so many types, so it's essential that you give readers a clear idea of what type of study you have undertaken. Depending on what type of study you are doing, that may well be recognized reporting guidelines for that type of study. And also what study population you investigated. This is actually baseline information. That's pretty easy to describe study population if you are talking about people or patients. And you have to describe, did you study here with the ethical approval? Do you have patient consent? If you don't, then why not? And statistical analysis, the method assessment, are the core part of method section. You should describe this in detail. And how about your funding role? So the overall message is to provide sufficient information in your method section to allow the reader, if they so desire, repeat your work. If the study is far too complex, at least you can use the appendix to add more detail. After the methods, come to the results. You need to decide on the logical order to which you present your results. Clearly report the primary endpoint or aim of the study and whether it has been met. You should give an actual number rather than just a percentage. You need to give an indication of the precision and clearly label any post-hoc analysis done. Come to the discussion. This is a very important section of the article. This is where you interpret what your results mean and where you get a chance to sell your data. The discussion needs to correspond to the results section, but not simply repeat your results. So you need to compare your findings with other published results and avoid temptation to ignore work that disagree with your own. You need to confront it and integrate it into a whole world interpretations. Sometimes researchers are reluctant to discuss limitation, but we encourage authors to critique their work. If they didn't mention that, and reviewer may feel you are trying to have things. It's good to offer suggestions for future research, but should be careful of the statements that go beyond what results can support. You should avoid non-specific expressions, such as things like higher or lower. Yeah, that is the main body of the paper, but of course you need to get your references together. The references are where you set the main scientific publication on which you base your work. Typically, there are more mistakes in the references than any other part of the manuscript, so it's worth giving attention to this section. And you should always ensure that you have fully absorbed materials you are referencing, and do not just rely on checking excerpts or isolated sentences. And this is also your opportunity to let the editor, reviewer, and the readers know that you have done your due diligence and truly have an understanding of all relevant work, especially any recent work. And you should avoid excessive self-citations of your own work and avoid citations only from just one region of the world. Of course, very importantly, as you should have been aware of the journal's guidelines on the permitted references. And also the guidelines describe how many citations around it is a proper number, but of course editors will make a judgment based on the content of the paper. Interdisciplinary paper often require more references. That is an important but I think often overlooked part of the paper is the acknowledgement section. Here you have the opportunity to acknowledge the people who supported in your work, but are not authors, maybe advisors, founders, proofreaders, the suppliers who may have donated materials. Also mentions to the Lancet should include disclosure of all relationships that could be viewed as presenting a potential or actual conflict of interest. The editor may use such information as a basis for editorial decisions and will publish such disclosures if they are believed to be important to readers in judging the manuscript. Agreements between authors and study sponsors that interfere with author's access to all of study data or that interfere with their ability to analyze and interpret the data and to prepare and publish manuscripts independently may represent conflicts of interest and should be avoided. So at the end, overall, what makes a good manuscript? It can take the scientific message, but it's clear, useful, and ideally exciting. Although it's realized there is a lot of very important work for this together, it's not necessarily exciting. The conveyed author thoughts in a logical manner such that the readers arrive at the same conclusion of the author. It's constructing the format the best showcases or the material of written style that transmit the message clear. Obviously, the core concept is the essential part of your paper, especially make reviewers and editors grasp the scientific significance as easily as possible. It is not always easy to do. Sometimes research are complex and the messages can be difficult to convey. Anyway, try to do that, making it easy for them to digest what you are trying to convey. Thank you for listening. Hi everyone, it's a pleasure to be here.
You can see me, but I'll start speaking anyway. As you know by now, myself, Haoyu, and Al are the full-time editors at Lancet Planetary Health, and I want to talk a bit about what we do at the journal and the processes through which we make our decisions. So the core of our job is ultimately to determine what the content of the journal is. And for research papers, that means that as a team, we read and discuss the manuscripts at initial submission, and then we decide, using our editorial criteria, which I'll describe later, which should be sent out for peer review. We identify those reviewers, we receive and we interpret the peer reviews, and discuss the feedback with our other editorial colleagues from across the Lancet, and then we make a final decision as to whether to publish the manuscripts in Lancet Planetary Health. And as the manuscript's going through those various processes, we also feed back to authors on our interpretation of the reviews and our advice on article quality, transparent reporting, and research ethics. In addition to that core part of our job of shepherding papers through peer review, we also commission and edit content. So things like review articles, commentaries, news features on a pressing topic. We also write some content for the journal. So the editorial that goes out with the monthly issue, for example, that presents the journal's viewpoint on a current affair. With accepted manuscripts, we work on ways to amplify their impact, such as press releases and social media. And then finally, our role has an outreach component where we'll attend conferences, public lectures, make visits to research institutes, and to keep up with what's going on in the field. The journal has an external advisory board. This is a few of them. You can see the full advisory board on our website. We select these members to represent the breadth of the areas of research that the journal covers. And the board advises on general scope of the journal, developments of interest within their research field. And we occasionally might contact them to advise on a technical or conceptual point about a specific paper that we have under consideration. So back to evaluating those research manuscripts, what criteria do we use to decide whether we're going to pursue a manuscript when it's submitted? What we as journal editors are looking for from a manuscript in the first instance is a substantial conceptual advance within the field. And it's important to make a distinction between conceptual advance or conceptual novelty and pure novelty, i.e. simply, this is the first time that any researcher has looked at this question in a specific country or population or with this instrument, but the findings essentially reconfirm what we already knew conceptually from previous work. That's not really what we're looking for. We're looking for findings that meaningfully advance understanding within the field. Secondly, we're looking for topics and findings that will have broad interests across the people working toward planetary health. We're a thematic cross-disciplinary journal, so we're looking for work that is going to influence thinking beyond its immediate research community. There are a couple of other types of paper that meet this editorial bar. We also consider research impactful if it provides a substantial evidence-based advance. So, for example, if the findings aren't conceptually original, but it provides a robust mechanistic insight where previously something has only been demonstrated through association or theoretical modeling, or perhaps it's using a more robust and larger data set where previously something has only been shown with scant data or with very high uncertainty. Impacts could also mean something that identifies a promising new avenue for research, for example, by using a technique taken from another field, which might be an innovation for future research. And in addition to all this, we'll also, of course, be checking that the manuscript provides some strong support for its rationale, its methods, and its data for the conclusions that are reached. But the detailed methodological assessment comes from the peer review. As I've said, the decision to send to review and to publish is ultimately made by us, and we'll keep going back to these criteria of conceptual novelty and general interest throughout the process of a paper. But of course, we do ask peer reviewers to comment on those aspects of novelty, importance, and interest. What I said just now relates only to research papers. So if you're interested in how we make decisions on things like review articles or perspectives, then please feel free to ask at the Q&A at the end of the webinar. The second hurdle that a manuscript has to go through is checking for technical soundness, which is mostly done through the external peer review. If we send a paper out for review, we'll typically invite 4 anonymous referees. When inviting those referees, we'll aim to cover all aspects of the paper, so all of the topic areas it covers, the methods used, the geographical location of the study, if that's relevant. In each case, we look for an established researcher in the field who has a good publication record or specialist knowledge of the area. We want an unbiased review, so we won't invite somebody who's a former colleague or a frequent co-author with the manuscript authors or from the same institution. And we're careful not to invite referees who might be overloaded with other work or other manuscripts so that they have the time to put into critiquing the manuscript. We also aim for diversity of gender and geography when we're inviting people for the review panel. Once the referee reports are in, we'll discuss them amongst the Lancet Planetary Health editorial team, but we also take the paper and the reviews for discussion at a cross-Lancet editorial meeting so that we can get the opinions and the expertise of our editorial colleagues from across the Lancet journals. And of course, before acceptance, we often invite authors to revise their manuscripts in response to the reviewer and the editorial feedback. And we often have manuscripts re-reviewed once they've been revised. So once a paper is accepted, this is the point when we might do something like commission a linked commentary from somebody who's not on the authorship of the paper to try and contextualize the paper and its implications, and that'll publish alongside the paper. Usually actually before acceptance, we'll check that we have all of the relevant paperwork back in on contributions of authors, conflicts of interest and research ethics. We'll check that the manuscript is roughly correct for Lancet style in terms of its layout, and that we have the correct type of files that we can work with, figures and things like that. After acceptance, we have a team of in-house dedicated assistant editors who, with feedback from us, the journal editors, edit the manuscript's language for clarity and to make sure that it's in that Lancet journal house style. We also have dedicated in-house illustrators who will redraw graphs and tables to match our style and so that they're clear. And we send proofs back to the authors with the suggested edits and the questions for clarity to get their feedback. And again, this is a process between the authors, the assistant editors who know Lancet style and reporting standards very well, and us, the journal editors, who know the paper, its review history, and are familiar with the field and its standards. Also, if we think that a paper is newsworthy, then we'll work with our colleagues in the Lancet press department to write press releases, and they're very good at disseminating those to the relevant journalists. And occasionally we might commission a Lancet podcast episode on an interesting paper, and occasionally have our team create an infographic to go along with social media posts. If you do decide to publish your work with us, it will benefit from the high reach and visibility that we have. We're ranked very highly in terms of impact factor among environmental science and health journals globally. The papers in our journal are on average highly cited, and we're a trusted source of quality research in planetary health, environmental health, and sustainability communities. We have a global reach, so we appear across a wide range of abstract and indexing services, which increases the visibility of the papers that we publish. And of course, we benefit from being part of the wider Lancet journal family of journals. So these are well known and well reputed, and between the Lancet journals, they have tens of millions of website views and article downloads annually. Millions of people subscribed to their table of content alerts and following on social media. And our content is extremely well covered and represented by media outlets, which again enhances the reach and impact of the papers that we publish. And I think now it's time for the Q&A.
Brilliant. Thanks, John. Okay, yeah, we've got some questions. So we're just, the way the questions come up to us, they're just in a dialogue box. And while we're going through the questions, I'd encourage you, if you've got any more questions to ask, please fire them away into the box and we'll try and get to them. So I'm just going to read out some questions and then John and I will kind of respond to them individually. So I've got one here, which is saying, as a younger researcher, it's my dream to publish in Lancet journals. Is there any specific section for younger researchers or students? So the short answer is no. There's not a dedicated section, but possibly the commentary section might be a good place. If I mean, certainly in Lancet Planetary Health, we regularly publish commentaries which represent the perspectives of young campaigners, for example. But essentially, the same rules apply as to everyone else. So, you know, we're looking for content that's going to be interesting to our broad readership. And now that obviously includes perspectives from young researchers, and often they're in a position to have interesting things to say. But we don't have a separate section. So commentaries are a good place to think about. But otherwise, if you're talking about research papers or reviews and things like that, then essentially it's a level playing field. The rules are the same for everyone. So we don't really think about the identity of the researchers in those cases. We just look at what the arguments that are presented and what we learn and make a decision about whether that's interesting. Have you got anything to add to that one, John?
Nothing specifically to that one.
Okay. So then next question was about, do we have any plans to publish plain English summaries of research so that we can kind of close the knowledge gap between academia and healthcare teams and patients and the wider community? We don't. I mean, what we do is we already try to publish abstracts which are as plain English as possible, and they're already certainly not. We aspire to write them, and this is common for most selective journals, again, that are trying to reach a broad audience. We try to write them, you know, with minimum use of acronyms and specialist terms, because even if we're talking to other academics, they're not necessarily academics within the community that are familiar with the field. So, you know, one of the kind of ways that you can view the editorial team as a kind of a proxy for this wider audience that you're trying to reach. So if you can talk to us, who are essentially non-specialists in many of the things that we handle, if you can convince us that it's interesting and important, then you've got a good chance of being able to convince other individuals that that's the case too. So we already try and make our abstracts relatively plain English, but we don't have a special provision, or I'm aware of any plans to have special provision for plain English summaries, at least not for all papers. Often, if we think a paper is particularly interesting, it gets press released, and so then there's a kind of a plain English example written and shared with the media, and obviously through social media and such like. Those kind of activities are taken. Okay, so next question was on publication of articles or papers in other languages different from English. Do we do that? Do you want to take that one, John?
Yeah, no, we don't publish entire articles in languages other than English, but we do have a service that we sometimes use where we can publish the abstract of an article in a different language. I think at the moment we have capacity to do that in Spanish and Mandarin Chinese, but we don't publish entire articles in a language other than English.
Thank you. So we've got a question here. Do Lancet Planetary Health show interest in the application of AI for science, like the application of large language models, for example? So to come back to John's point about the way that we make decisions on manuscripts, we wouldn't normally make the decision on the basis of whether we think a particular method or technique is something that's of interest to us. We would usually start back from the findings. So we'd want to know, does the application of this language model deliver a finding that is likely to be interesting to our audience? So does it tell us something new, conceptually new or interesting or useful? And if it does, then absolutely, we're 100% interested in application of AI. And of course, it's a fast-moving area, so it's something that we're interested in seeing how that might evolve, and open to publishing discursive points about the value of AI in science, etc. But I wouldn't say so the short answer is yes, we're interested, but we're most concerned about the way it's applied and whether it provides new insights rather than any particular method or application or even data set. Anything to add to that one, John?
Only that we're open essentially to methodologies. It's more pertinent that the papers are relevant to the problem that we're trying to solve, which is planetary health and environmental collapse, those kinds of problems.
What I'd say is, as a rule, that we are pretty open-minded and we're open to being convinced. So again, you can kind of use us. So even if the approaches that are being used are maybe not the most conventional or most routinely used, we're definitely open to use of different methods and approaches. And if you can convince us that you've shown something new and potentially impactful, then we'll definitely consider it. Okay, so it was quite a specific one. I've read about a word limit of 3,500 words. Is this the case for, and then something really specific about figure widths, which I don't think is correct. The question is this the case for every single article? How flexible are we within these limits? We've got a fair bit of editorial discretion, so we can decide if a paper needs to be longer or shorter. I don't think this thing about a particular figure width, I'm not sure where you've got that. But certainly at the point of submission, I wouldn't worry about anything like that. We have a general tendency, because of in answering the earlier question, is this issue, we have a desire to make our papers as readable as possible for the widest audience as possible, and briefer papers are more readable in general. So we always have a kind of a downward pressure on length. We don't want papers to become very expansive. And so the 3,500 word limit is a kind of a downward pressure, which aspiring to short, succinct papers which are easy to read and explain the key messages quickly and succinctly. We do find sometimes that papers are very complicated. They use multiple methods. Often that's particularly true with interdisciplinary studies, and then longer articles aren't justified. And so we certainly have some editorial discretion there. What our kind of model is is not to ask for you to jump through too many hoops at the point of submission, because the journals like the Lancet Planetary Health reject a lot of manuscripts on editorial criteria without sending them to the reviewing quite quickly. And so we don't want to create an awful lot of hoops for you to jump through just so that we can say that we're not interested in this paper. So at the point of submission, I wouldn't worry too much about article limits and figure numbers and things like that. Obviously, you don't want it to be, crazily long, but if it's kind of in the right ballpark and you're making your case, that's the thing that we'll consider. And if it does well in peer review, at the point of revision, that's when we'll say, look, actually, it's a bit long, or can you move some of this to an appendix or something like that? So yeah, in general, I would say not to worry too much about these things. We certainly do have some editorial discretion. And again, we're reasonable people. By and large, you don't want to pull your hair out to make sure it's exactly 3,500 words when 3,700 would just be a lot easier and more readable. And in practice, sometimes they can be up to sort of 5,000 words. So it just depends on the paper. Okay. How do we decide, maybe John's well placed to answer this one, how do we decide between Lancet Planetary Health and Lancet Public Health as the best place to submit a manuscript? In some cases, topics overlap, and it could be beneficial to have a more clear understanding of preferences. So John used to work on public health, so he can talk about this one authoritatively.
Sure, yeah, no, it's a good question because, yeah, there is often overlap. Lancet Public Health publish things on climate change, for example, and how that impacts on the population scale. I think the important difference to think about is probably audience from an author's perspective. So which audience do you want your paper to be read by and seen by? And obviously the Lancet Public Health predominantly has a readership and audience that centers around epidemiology and traditional public health, not exclusively, but predominantly, whereas our readership is probably more along the lines of sustainability research, environmental epidemiology, more specifically ecology, and it's actually quite eclectic. I think that because we're a thematic journal rather than a subject-specific journal, as I was saying before, we have a bit of a broader palette in terms of the types of questions we're interested in and the types of methodology that we're willing to consider as well, because we recognize, and one of Al's favorite topics is integrative research, so you could talk a bit more about this, but that for a wicked problem like climate change or ecological breakdown, it's often necessary to involve multiple fields in a disciplinary way. So perhaps we're more open and interested in those kinds of research, and we would publish, I don't know, things from probably economics or ecology, whereas the Lancet Public Health might be less interested in those types of topics.
Also, where there is overlap in the kind of Venn diagram of our interests, it's really down to the authors most primarily. Like if there are good papers, sort of really cutting edge, interesting, exciting papers that fall within the Venn diagram of overlap, we would both grab them with both hands if we get the opportunity. So it's really down to you as authors to decide what's the best place. Also, if we think maybe it's a better match for the scope of another journal, we very often will share it through the editorial manager system and ask related Lancet journals whether they might be interested in a transfer. Okay, that's great. So there's a question here. Thanks for one wondering, does the Lancet Planetary Health welcome papers in the discipline of social science, for example, sociology and organizational behavior, behavioral psychology, etc.? Short answer is yes. As we said, we don't really have topics that we think are suitable. So we work back from the findings. So the question is, do the findings speak to the issues that we're trying to address within planetary health? If they do, then we're open to all kinds of different topics, approaches, and certainly we are open to social science. We don't have any kind of notion that these aren't, papers that should be within the Lancet Planetary Health. Do you have anything to add to that one, John?
No, I agree that we're very open to sort of methodology. We're not interested in publishing siloed research. We like collaboration between fields as long as it's answering an interesting and important question that's pertinent to planetary health.
Okay, thank you. There's quite a specific question here on microplastics. So someone's saying, for microplastic-related research, what are the topics the journal is interested in? My research is in environmental engineering with a research focus on the transport and fate of microplastics. Will this fill the journal's scope? So again, the question for us, 100% we're interested in issues of microplastics, and it's very concerning how sort of ubiquitous they become, and not least because if we do at some point find out that there's long-term health consequences, it's going to be very hard to actually address the problem on a short time frame because they're already ubiquitously in the environment. Questions of transport of microplastics is something that we would consider publishing, but I think it's a topic that we'd really be looking for like a clear advance in our understanding. So if it's telling us that something more about how they're being transported or where they're concentrating or how they're getting into, food chain or being inhaled or something, it's certainly a topic that is within the scope. Okay. So there's a question about funding. So it's a sort of interesting one. So much much of my work in global health, climate change research is funded by Bill and Melinda Gates Foundation, UK government funding councils, and the Wellcome Trust. Many of these funders are moving away from paying APCs from 2025. Will this change the publication landscape significantly? What is the Lancet Planetary Health's position on this, and will there be facilities for fee waivers? Well, let's start with the fee waivers bit. There's already, so to some extent, open access journals have the same problem as subscription journals. They just transfer, but the point in the system is different, right? So for subscription journals, you have to pay to access things, and if you want to increase accessibility, you have to create waivers for people who aren't able to pay, and the open access model just turns that on its head. So if we want people to have access to publish, but they don't have the money, then we have to waive those waivers in those situations. So we do have that in place already. So we have several mechanisms in place. One is through the Research for Life system that we're members of. So that means that people from certain, if the lead authors are from certain countries, or if all the authors are from certain countries, then when they submit their paper and go through the system, they will automatically have their fee waived, or they'll have a discount applied. We also have a kind of ad hoc system. So any time that a paper has done well, but authors don't have in review, but the authors don't have the capacity to pay, then we have like a case-by-case system. So you can just email us and say, look, we can't afford to pay the fee, and we've investigated all the ways in which we can try and find funds, and we can't find any. And then there's a panel that we can take that to, and they make a decision about whether, normally they're much more open to offering a discount than they are a full waiver, but it is certainly possible to get a full waiver through that process. That's something that we as editors only have partial influence on. And then in the wider question about what that means for open access publishing and the affordability of open access publishing, I don't know what impact that's going to have. Only time will tell, I guess. But the practical mechanisms by which we will deal with that is you either get your fee waived, that you might have an institutional agreement which already gives you a discount, so you can investigate that. If you do have that, I believe that's also automatically applied through the editorial manager system. But if you don't qualify for any of that, or the discount isn't sufficient, but you still want to publish with us, you can email us and explain the situation and say, look, can we have a waiver or a discount in this case? And then we can send that to the waiver panel and see how that goes. So someone's asked about the question that John raised in when he was talking, that he was mostly talking about research articles. So what's the question? What's the way that we make decisions or personal views, for example? So the basic principle is somewhat similar in that we're still looking for a kind of a new insight or perspective, but with personal views, they're allowed to be a little bit more forward-looking, a bit more speculative. So they're often trying to map or suggest areas of research that we think, or areas for future exploration. Often trying to highlight areas that they think are neglected or have lots of potential. And we're essentially trying to decide, is there something new here? It might be a synthesis, but is this synthesis bringing together some perspective which is not widely known within the community, or that the community would benefit from hearing? And, does it interest us? Does it seem like it's something that could be impactful? If so, then we take it through a peer review process, very similarly to research articles. Okay, what have we got? So are we interested in the topic of global mapping on some functional microbiome? So essentially the same question. There's the same question for every, the same answer to all of these topic-specific questions. It's like, broadly speaking, probably yes, but the question is, does this paper deliver a new finding which has a significant, has the potential to have significant impact on maybe other research fields, or this particular research field, or policy or something? So if a research paper in this topic delivers a new finding which has the potential to be informative to policy or to other research fields, or very impactful within that research field, then absolutely we would consider it. How are we doing? How do I join the Lancet Journal as a profession? John, do you want to go and do a bit of a, how can you get into editorial work?
Yeah, so I assume you mean
partly with some luck.
A full-time editor. The jobs are advertised on LinkedIn and various places where you find other jobs for journal editors, not just us, but places like Springer Nature have full-time editors, NEJM, etc. Usually the editors are hired, well, always the editors are hired from people who have research backgrounds, and I suppose with other Lancet journals it would be a research plus a medical background. There's an application process. You're interviewed, essentially. The interview assesses how well you can look at a manuscript and judge it based on those types of criteria that we were talking about before. So it's assess whether it would be interesting to a general audience, whether it does have substantial conceptual novelty, and then it will depend a little bit on the journal, because some subject-specific journals, okay, they will be interested in publishing work that has maybe more technical relevance to their field, so that might be more interest to them, but it is a job that you can apply for.
Thank you. So there's one more of the, what kind of HIV studies are suitable for the Lancet Planetary Health? So it's a similar question, but this one's kind of specific. I mean, again, we would be looking for some kind of environment angle. So for it to be published with us rather than a HIV journal or more specialist journal, we would be looking for some kind of new finding that was related to the way that either infection or treatment or something related to the HIV is influenced by the environment. That would be the kind of the thing that would make us a more likely outlet rather than a specialist HIV journal, for example.
Yeah, I can think of an example that we've published that related rainfall, I believe, to adherence to HIV treatment. So that's an example of a paper that we've published where there's the overlap between an environmental aspect and an HIV.
Yeah. Thank you. All right, there's one more. We're nearly at time, but there's one good question here which we'll try and answer in the next couple of minutes. So how are the Lancet journals handling publication bias? And by that, the questioner means authors from low-income countries have less chance to publish in top-tier journals as compared to those from developed countries or famous universities. So what I'd say is, in the first instance, we certainly don't take into account where someone is based or which university they're in or anything like that when we're making a decision about a manuscript. So we always have the same criteria, which we want to find out what have you found? How does that differ from what we already know from the literature, and how impactful might that be? That's essentially the process we go through with every paper. And that's got nothing to do with which institution you're in or not. Now, of course, some institutions are very well funded and they have lots of very established research histories, and they're very used to writing for selected journals. So that gives them some advantages in pitching papers to our kind of outlets. But it's certainly not, there isn't a publication bias in the sense that we don't favor or prefer papers from, established or rich or well-known institutions. So what I would say is the main thing you can do really is to ask interesting questions and pitch them to us, and bear in mind that most people get rejected a lot of the time, including very famous names who submit to us a great deal. So if you want to get your papers published in selective journals, you have to submit them regularly, for there to be a chance, because statistically speaking, it's quite likely you're going to get rejected on editorial grounds, but it shouldn't be disparaged by that. That's a natural part of the process, and you're probably going to have to try a number of times. Obviously, there are some intrinsic biases in the world, which are hard for us to completely compensate for. But what I would say is, we're very interested in research from different parts of the world. We will sometimes apply a different kind of, in the same way that we would with different fields, depending on how developed a field is, we might require a different level of evidence, if you like. And so more developed fields require more convincing evidence, whereas very new fields might be interesting to publish something that's quite I wouldn't use the word speculative, but let's say not as secure. And we would have some similar policies for data poor parts of the world where they don't have, there aren't such big data sets and long data sets. We would still be interested in publishing if it's sufficiently robust to say something interesting in those regions. So anyway, I hope that at least goes some way to answering your question. I believe we're pretty much at time. So yeah, I'll just thank you very much for joining us. Really appreciate you taking part and answering so many good questions. I hope this was useful, and look forward to future interactions.